Hi, I am told I am live. Hi, everybody. I am Janet Finley. I'm an ACE instructor, and I am going to be talking today about some of the science behind ACE. I have to say, I am ridiculously nervous doing this. This is such a great event. And I don't know why. I was just saying to Penny's in the background. She's going to be bringing comments up and stuff. And I was just saying to Penny earlier that I'm really kind of like, oh my goodness, I'm just about doing this. So bear with me if everything goes a little bit, my brain goes off on one. So I can see that there's some people watching, so that is great. The way that we're working with StreamYard here, and the reason for that is that it means that we can bring the comments in and I can see the comments, but also Penny can bring them up onto the screen. So if you've got comments during the presentation, I'm going to bring up a presentation in a minute. If you've got comments or questions during the presentation, pop them in the comments. If you allow StreamYard to use your, so okay to be nerdy, thank you. If you allow StreamYard to use your Facebook, then I'll know who you are. Otherwise, it'll come up as Facebook user. Either is okay. But if I don't use your name, that's probably because you're showing to me as Facebook user and I have no idea who it is. And I'll find that out later. The questions, Martha started barking already. The questions, I'm happy to take questions at any point. But do bear in mind what I've got here is a reduction of a 4-5, I think it was a 6-hour workshop. And I'm reducing it. I've said I'll try and stick to 90 minutes. So it's going to be quite a whistle stop tour as it is. And obviously, if I get a lot of distractions with questions, then it's going to be take a bit longer. So anyway, feel free to ask. All right, so let me see if I can bring up my laptop. I'm going to share. No, I've got to do it on here. Oh, so to add that to the stream. Yes, there we go. So can you see? Hi, everybody. I can see people are here, and I'm guessing you can hear me. I'm sure Penny would tell me if nobody could hear me, so that's okay. All right. So what I'm going to be talking about is some of the science behind free work and observations. I'm a bit of a geek. I'm a bit of a science geek. I started off as a researcher. So my job before I became a dog professional was I was a professor of computer science, funnily enough, and the human side of computing specifically and technology enhanced learning. So that was my kind of background. And so doing the science stuff is kind of been my bread and butter, and I'm always really fascinated by, what the evidence is for things. Now, the thing about ACE is ACE is relatively new in terms of science. Is really new. It's it's a few years old. I mean, it's obviously, as Sarah I think was saying yesterday or day before yesterday, it's got a long history. So a lot longer than that. The work that she's done to develop that has developed into ACE and that is now structured as ACE is a lot older than that. But as a structured approach, ACE is a few years old. I think it was 2018 that it was first sort of put out like that. And the thing about that is that you're not going to get any study. Well, there's two reasons you're not going to get studies about ACE right now. One is that it's quite new. The other is that research is expensive. When I was doing research, when I was working in research as a researcher and as a professor in research departments, the research I was doing was being funded by government agencies to the tune of hundreds of thousands of pounds or even millions, the projects, and you had to apply for that. And so the chances of getting that sort of funding for research on something like ACE is very, very limited, even if you had somebody who was in a position to get the sort of funding. And of course, you'd have to be in the sort of setup like a university that would allow you to do that. So what we might be seeing fairly soon is, I'm pretty sure there will be some students out there who are doing dissertations and things like that, who might be looking at ACE. And if you are a student, a dog behavior student who is doing a dissertation that's relating to ACE, I would love to know about it. So please let me know about that, because I would love to add that to my list of things, what you find out from that. But those are more informal studies. They may be designed in a science way, but they're not big peer-reviewed studies. Hi Matt. Hi. found me. Good. Okay, I'm just wittering on at the beginning to let everybody come on, so that's cool. So there's lots of reasons why you won't find. Yeah, absolutely. Hopefully, some MSc students will do dissertations on ACE and publish the results. Totally. So we really hope that that will be the case. But what you're going to get tonight, because those things aren't out there yet, people correct me if I'm wrong, if they have found anything that's specific to ACE, but generally they're not. What you're going to hear tonight is some of the papers that back up what might be going on when we look at ACE, because we know that ACE is effective. I mean, the guys posted a video of lots of quotes from people as to what they'd seen when they were doing ACE with their dog, and it was lovely. And that is evidence. It's qualitative evidence. It's what we call qualitative. It's people's experience. It's quite subjective evidence, but it is nonetheless evidence. And it's kind of like the science of one, each individual animal. And there's nothing wrong with that, but it's not what you would call peer-reviewed science. So we love that evidence, and the more of that we get, the better. But also we want to look at, well, why might this be working? Why might it be working? And that's what I'm doing today. So I've got two computers going here. I'm using the wrong mouse. Let me just use the right mouse, or I'll do something really strange. Okay, there we go. So first of all, I was told that this is early on. Oh, well, I knew it was early on because I knew the 5th. Is it the 4th? 5th? Anyway, 4th of August. So it's pretty early on. But also that quite a few people here were new to ACE, which is fantastic, and it's wonderful to have you. So I'm so excited that people are coming into this group and learning about ACE, because ACE is incredible. It's an incredible approach. So just drop in the chat if you are new, if you're qualified in ACE in some way, if you've got a bit of knowledge and you've done a little bit. Just give us a flavor of who's actually on this call, just so that I know how much emphasis to put on the introduction to what ACE is. And in the meantime, I'll say hi to everybody. Hi, Marion. I can see lots of highs, but I can only see a few names because most of you haven't given permission to stream out. That's fine. New, completely new. Good. Okay. I know we've got some people who have got quite a lot of experience with ACE, but we've also got a little bit of knowledge, new, complete novice with very little knowledge about ACE, done a bit, advanced tutor, ACE associate tutor, perfect. Okay, so we've got a good range, so that's great. So I'm just going to give a little introduction to what ACE is. Being on 5 courses at Tilly Farm, well, you will know a lot, so that is great. No, not professional, just done some with my dog. Learned about ACE from me. Hi, Jean. Yeah, using it ever since, and talk about it on every consult since. That's brilliant. I love that. Okay, so some familiar faces coming up here, some familiar names. Brilliant. All right, so ACE is an integrated, structured approach to animal well-being and education being developed by wonderful Sarah Fisher, who, if you didn't see the other night, watch that, because that'll tell you where ACE started. And Sarah's work is incredible, and her work on observations is, I believe, second to none. And there is some research that is coming up in here, which is not a pleasant research, but it absolutely validates the work Sarah's doing. So I had to put it in. But ACE combines a whole set of things, but it combines free work and the things that we're going to be looking at today, free work and detailed observations. So using free work as a method and using that as a way of also being able to look at the dogs in a very detailed and specific way so that we can see what is going on with them. And then there's also other elements, conversational training games, leading techniques, body work, all of those things fitting in to that. I'm using the wrong mouse again. I think I'm just gonna have to put that mouse out the way, otherwise I will be constantly hitting the wrong button. So detailed observations, we're looking to find signs that might indicate pain, tension, or discomfort. We might want to identify things that are concerning our dogs as we're doing the free work. So we're looking for the things that might be worrying them, that they maybe have concerns about. And we're looking for those little clues that we otherwise may miss. So one of the great things about ACE is that it is really taking observation to another level. We're probably, if we're dog people, oh, somebody introduced to ACE by Shona Moon, bless Shona. Yeah, we are used to observing dogs at the level of stress signs and things like that. Most of us, if we're dog professionals, if we're not, we may not be aware of those either. But what ACE does is take that to the nth degree. So what are the little tiny clues that you can see in what your dog does and how they respond to things that actually give you information about what we call candles being lit? So things that are going to be influencing and making our dog respond differently, changing how our dog may be feeling, making things more stressful for our dog. So, yes, I have got the right thing this time. There we go. So free work. So we've got the detailed observations. We've got free work. And free work is, I like to think of it as the dog learning about their environment while we're learning about them. So the dog is free to explore. They are investigating a range of things that we put out for them. And while they're doing that, rather than intervening and trying to influence, what we're doing is learning and observing and learning about them. And so free work includes a range of surfaces. It might include enrichment activities. It might include stations of different heights so that we can gauge what is a good height to deliver reinforcement to our dog. Includes water bowls, because drinking is important, particularly when dogs are thinking. And we use food, and we use different sorts of food for different purposes. So we'll use little bits of food that are easy to eat that the dog may be able to search for and find. We'll use soft, sticky food to encourage licking, and we'll use larger, chewy things to encourage chewing. And we'll look later at why all of those things are important. And the important difference between this and many other methods, including things like T-touch groundwork, is that in ACE free work, dogs work free of ideally all equipment. So you'll see in the top picture there, Martha, my collie, has a collar on, but ideally you would have a collar off. That was me forgetting to take it off in the garden thing. Sophie in the bottom picture, Roz's dog, Roz Kinlock's dog, she is working in a free work course that without any equipment on at all. So we're doing this in a safe environment so our dogs can explore. And ideally, we're working them free of all equipment. Obviously, if safety requires you to have equipment, then you have something on your dog. But ideally, we'd be working free of all equipment because that allows our dog to investigate through their own choice. And we are not influencing them in any way. Okay, so what I want to talk about, what are we up to? Oh, we're 15 minutes in already. Oh my goodness. Okay. So what I really want to talk about is two things. I want to talk about some of the science behind those detailed observations and some of the science behind free work. So some of the science that gives you evidence as to why these things would be useful. And I've done this deliberately to be as accessible as possible. So you're getting the headlines of this research. So if you are a researcher, if you are actually, one of the scientists doing this, my apologies that I am actually cutting out all the nuance of what you've done, because that is not what the purpose of this is. I'm trying to make this as accessible as possible, but I am giving you all the references, and a lot of these papers are open access, and you'll be able to go and read them if you want to. Some of them are much easier to read than others, and I'll point you to the ones that I think are actually really good reads as I go along. Some of them I wouldn't recommend reading, particularly unless you are a scientist. Even as a scientist, I found them very, very difficult. But anyway, I'll go through those as we go. Okay, so what are we looking for in observations? Well, we're looking at the nervous system responses. So what is going on that is a response to that our dog's nervous system is responding to their environment. And I'll talk a bit more about what that might look like. We're looking at postural and physical signs that we can spot in our dog. One of those is coat pattern, another is gait and things like that. And then we're looking at their behavioral responses. And what I'm going to focus on in this presentation is particularly pain, the impact of pain on a couple of things, and a little bit about stress and balance, but not so much on those things, but I will touch on it. So stress and pain indicators. Don't worry about the details of this. In fact, you may not be able to see the details of this, depends if you're watching this on a big screen or not. But I can make these slides available to as a PDF so people can look at this later. Nervous system responses. Our nervous system, we have autonomic nervous system, rest and digest, you'll know that as sympathetic nervous system, fight or flight. And the fight or flight response releases chemicals into the bloodstream, which basically changes how our body is responding. And that is a nervous system response. That's what we call a nervous system response. And the sort of things that we're looking for, we can see this is a picture of a person, and it's exactly the same for people as for dogs, but we will see the same sort of things. So you will see things like, you'll see breathing increase. You will see muscles tense up. You will see pupils dilate. You'll see the hair stand up on end. You'll see, what else have we got on here? The heartbeat go up, heartbeat increase. And when you see those things, within ACE, what we're doing when we're doing the observations, the first thing we're looking at is the nervous system responses. What are we seeing? What's the dog's breathing like? What's the hair looking like? Is that changing? Can we see the dog's pupils? Can we see what sort of blinking what are their muscles like? Are they tense and so on? So those things is basic. This is basic biology. This isn't research. This is basic biology. But the first thing that we need to just set in context is that we are looking at biological responses to stress. So fight or flight is the biological responses to stress. And we need to learn to actually recognize those things. And that's something that we're doing in ACE. So part of the ACE responses, the nervous system responses, is to be able to recognize that in your dog. Noticing when your dog's breathing goes up and what is triggering that. Notice when the heartbeat increases and what is triggering that. But in dogs as well, we are, most of us probably aware. Well, let's just see who's aware of calming signals. Who knows about this? This is Rodriguez's levels, increasing levels in terms of stress. Who's aware of these things? Yeah, people couldn't find us. Hopefully, you found us now. You obviously have found us now. Anybody who's aware of Jorid? Yes. Just say yes or no. To if you're aware of Jorid. Yeah, okay, cool. So you'll see on here that there are what she calls displacement behaviors, sniffing the ground and scratching at the lower level of stress. So if a dog starts to become uncomfortable, that they start displacing. And people are the same. So we may have different behaviors. Our displacement behaviors may not be sniffing the ground and scratching, but we will still have displacement behaviors when we're slightly uncomfortable. But dogs will too. And then we have calming signals. I'm going to talk a little bit about calming signals, a bit more about calming signals in a minute. Things like yawning, lip licking. I always say lipping, but lip licking. Yeah, most people know about calming signals. A few know. Okay, cool. Looking away, so turning head away. Turning the body away and moving slowly, so slowing the movement down. So all of these things are things that are indicating to us. Well, what's interesting about calming signals is what are they indicating? Because they're, it's Rodriguez that called them calming signals. And then there's a lot of discussion about, are they calming and are they signals? But there's no doubt that we see these dogs doing these things. And then as we move up, we've got the nervous system responses, the panting, the pupil dilation, shaking off adrenaline, sweating, pause. These are the physical things, hackles going up, etc. And then we lose the calming signals, we get the dog freezing, and then we get growling and showing teeth. So that's the sort of the scale of, as the tension goes up, as stress goes up, as the dog becomes more stressed. When we're looking in You're so lip-lipping. Me too, Deb, me too. So when we're talking about this in ACE, we are never going to get, I really would hope we would never be getting up to those amber and red ones. We're looking at the calming signals, we're noticing those, we're listening to them, and we're noting the stress reactions as well. But what's interesting, I think about, and here's just some pictures of some of the sorts of things that we're talking about. So these dogs, you can see we've got some lip licking, said it right that time. We've got sniffing the ground and so on. We've got postural things as well. So the dog shrinking down, shrinking away, yawning. We've got a bit of waylie there, and we've got the collie in the corner whose respiration is up. They're panting and so on. But let's just look at one. The first paper I want to look at was this paper by Maritti and et al. And analysis of calming signals in domestic dogs. Are they signals or are they calming? Now, what they did was they actually looked, and again, this was a qualitative paper, they were looking at analyzing interactions between dogs. And they looked at a number of different interactions. And they looked at interactions between dogs known to each other, dogs not known to each other, and between male and female dogs. So a whole range. I'm not going into the details of that in this talk. But what they discovered when they did this, and they analyzed those interactions for calming signals. So they basically noted, and this is one of the ways that this sort of science works, they noticed when dogs were showing those signals and what was actually happening at the time. So the most common signals that they saw were a head turn, a nose lick, so that's licking the lips but up to the nose, freeze, so just that temporary freeze, not the kind of freeze that you get before an attack, but the temporary freeze, I'm not comfortable, and then a turn away. So those were their most common signals that dogs used with each other. And they always occurred during interaction. So what was interesting about them, they discovered, was that dogs don't do this when they're not interacting. So they're either interacting with other dogs or with us or with some other creature. They don't do them when they're on their own, doing nothing or just minding their own business. So they are communicative. It suggests that they have a communicative role. And they occurred more frequently between dogs who were unfamiliar. So dogs who didn't know each other before this interaction, there would be more calming signals going on. So it suggests that it's a way of actually mediating in a situation where you're less comfortable, because dogs are more likely to be comfortable with dogs that they already know. So there was more calming signals between unfamiliar dogs. And bear in mind then that if you're working with an unfamiliar dog yourself, you are unfamiliar. So because there's no doubt that dogs give these signals to us as well. So if you're unfamiliar, then to a dog, if you're a professional working with a dog, for instance, then you're likely to see these signals as communication, and we need to be learning to recognize them and see them. In the context of aggression, so if there was any tension between these dogs who didn't know each other, 67% of the calming signals were offered to the aggressor. So they were often to try and prevent aggression. So really the thing, are they calming? Yes. The intention, what was discovered in this paper, was that the intention of these was to de-escalate the aggression, and it worked in 80% of cases. So when a dog is doing this, they are not being aggressive to us. They are trying to get us to back off. And there's evidence of that. So we get to listen to that, and we get to actually observe those things. And that's one of the things that we do in ACE, is we really do look for, when are these things happening? When are we seeing these signals? When are dogs communicating to us in this way? And then we learn what we do to listen and to respond appropriately to the dog. Then, okay, so we move from that into pain. So we talked a little bit about stress, about pain, pain and problem behavior in dogs. This is a really well-cited paper. Lots of you, if you're in the industry, will know this paper. This is the Mills paper, Daniel Mills's paper. It's a review paper by a whole bunch of dog veterinary behaviorists. So basically, that's why there's so many authors. It was an international collaboration between a whole lot of different veterinary behaviorists. And what they did was review their caseloads. And they looked at their caseloads. And what they discovered was that between 28 and 82, and that's why there's such a big range, because this is, the lowest of them, the clinic, if you like, that had the lowest number that any clinic had was 28% of the cases they saw had a pain component. The highest one, 82% of cases that they saw had a pain component. And those pain components, don't worry too much about the categories, but they were either, they fell into the whole behavior problem was a result of pain. There were some underlying unidentified pain suspicions that were exacerbating the behavior problem. There were other parts or other sorts of behaviors that were being exacerbated, problem behaviors exacerbated by the pain, or there were things that were peripheral that were associated with pain. So there were different categories, some more serious than others. But essentially, what this paper says is that between, let's say, 30 and 80% of all behavior problems have a pain component. And that is massive. That is just massive. And the evidence of that is huge because what we're looking at in ACE is how can we identify signs that the dog may be in pain? It's one of the things we're doing in the observations. And the reason we're doing that is because so much of what is going on in the world with dogs and the problem behaviors they demonstrate is because they're in pain. And some of the other things that came out of this paper, which I think are really important as far as ACE is concerned, because we often get, I don't know about you if you're a professional here, but you may say to your clients, get a vet check and make sure that your dog is healthy. And you'll often get people coming back and say they've been checked and there is no pain. And what I want you to look at is some of these cases. This is one of the papers I would say go and read. This is actually a really accessible paper. It's open access, so it's free to download. A lot of it is case studies, and they're really easy to read. And what I would recommend is that you actually go and get this and read it, because it is fascinating. But a couple of the things, the conclusions they came to. One was that vets can normalize common symptoms in some breeds. Now, this is something that happens a lot with things like luxating patella in small dogs. So you will often, I have a little dog who has had, well, she still has luxating patella in one knee and is ready to have her second operation. Vets will tell you it's a standard thing. Well, unless it's a grade 4 luxating patella, it's not a problem. So you can have dogs whose kneecaps are slipping out of alignment, and vets will tell you that it's not a problem, that they're not in pain. Now, I don't know about you. I used to have a hip that slipped out of alignment occasionally, and it was never bad enough to have a hip replacement or anything like that. And it's actually improved as I've got older. But it was excruciating at that moment. It was absolutely excruciating at that moment. And I find it really disturbing that vets will assume that a dog who has a grade 2 luxating patella is not in pain or any discomfort. And I know that from my own experience with Otter, my little dog, when she had her knee operated on and fixed, that one patella, her reactivity reduced overnight. And it wasn't a desperately bad luxating patella. It was borderline operating, but I wanted to get it done. So yeah, it's something that we need to be standing up for. We need to be, and it's hard because we're not vets. Most of us are not vets, but it is not appropriate to be normalizing common symptoms. And it's great to have veterinary behaviorists saying that. That they're saying that, because we can actually then point them to papers like this and say, but look, this is what it gets to say. Yeah, hardest thing to get through, that a dog is in pain. Totally. Totally. It's one of the hardest things to convince some vets of. Not all vets by any means, and it's getting better, but certainly some. And the other main recommendation of this paper is that pain relief should be used if there's any, almost as a matter of course, if there's any suspicion at all that there might be a pain, then do a pain relief trial. And I've got some evidence as well of how much pain relief can make a difference to something in a minute, which is, again, really interesting. So yes, something really important. But I wanted to just highlight one of the case studies in this, because I think this is really useful for those of us who struggle with sometimes vets or indeed clients saying, well, they've had the x-rays and they've had the palpated and there's no sign of pain, and so on and so forth. This was a 2-year-old black Labrador in this case, one of the case studies in this paper. History of growling at the owners, particularly at the male, avoidance of uncarpeted surfaces in the house, and intermittent limping. All of those things would be some things that we, within ACE, if we'd done observations, we would be thinking they would be flags for us, pain. This dog had had multiple x-rays, multiple radiographs, with no abnormalities or evident, no evidence of pain on palpation. They were put on pain medication and their behavior improved. They also had behavior modification stuff going on. When the pain relief was removed, the behavior re-emerged. And that happened a few times with this case study. But what is really interesting about this is this little description of this dog. And those of you who are familiar with ACE will recognize some of these things that we're looking at, because we look at gait, we look at how the dog is standing. Are they weight bearing evenly? How symmetrical are they? What's their gait and their stride like? And these are the sorts of things that within ACE we can actually help our clients, because we can say to them, this is something that you can take to the vet. Let's video it. Let's show them, because they may not see it in the surgery. So, however, both of the dog's stifles were rotated out when he was standing. He tended to avoid weight bearing on his left hind leg. The dog appeared to have a short stride length with crossing over of hind limbs, so they're kind of crossing, and accompanied by inward rotation of the right hind foot. His rump would also sway slightly as he walked. Wet knicker walk, anybody? He would sit with his legs tucked under his abdomen and pointing cranially. There also appeared to be an atrophy of the semimembranous evident in the right hand. His muscle atrophy. Despite further radiographic assessment of the spine and the hind limbs, no physical lesion could be identified. Stifle is the bend, the joint in the hind leg. So the got your coming down from your hip, you've got a bend of stifle, you've got a stifle joint is the bit that joins with the bit that goes straight down to the ground. It's like equivalent of the knee in the front. And despite so no physical lesion could be identified. So even though there's all this going on, they couldn't find anything medically wrong. That does not mean the dog is not in pain. That does not mean the dog's physically normal, if you like. So I think we have to be, and this is something that, can I talk about adolescent dogs that can't stay in one position and they go to the bathroom? Probably not right now, but we might be able to talk about it later. Yeah, I mean, it could be that they can't stay in one position because it's of discomfort. It could be growth, that they're growing out, unevenly and so on. But I think the key thing about this that I just want to highlight is that there was lots of physical evidence that things weren't right for this dog. And notably, the dog got better when they were on pain relief, but there was no medical evidence for it. Okay. So we get to actually look at, this is where ACE can help us, because we're looking at these tiny details. Are the legs sticking out slightly awkwardly? When they move, are they moving evenly, or are they twisting, or a little bit, whatever? Are they rotating as they move? Those sorts of things are really important. Okay. Now, I'm putting a trigger warning in here. because this is distressing. This next bit of research I find really distressing. I know others have found it distressing when I've shared it. I have thought long and hard about sharing it because of this, but I think it is so mind-blowing in terms of what we do in ACE and what the evidence is, that I think it's important. So this research, it was done at Harvard. It's very, very well put together. It's also horrible. Okay. The paper is called Hyperactivation of Sympathetic Nerves Drives Depletion of Melanocyte Stem Cells. Don't worry about that. It was not done to look at coat pattern. It was done to find out where pain was actually being managed within the cells of the body. And they worked with rats, and it's particularly horrible. So I'm just letting you know that, so that you can actually turn away if you don't want to see this, or if you don't want to know about it, then go and make a cup of tea. What they did, they did a series of experiments, and they started off subjecting the rats to what they called minor stress. And what minor stress was restraint. So the rats would be placed in a restrained container for 4 hours a day. That was mild stress. They then also added more significant stressor, which was causing unpredictability in the environment. So they basically set the cage up so it would intermittently rock about and move, so the animal didn't know, the rat didn't know what was going to happen next, and they had that kind of stress of unpredictability. And then the third one, and this is where they ended up going because it had more dramatic results. They injected mice. Sorry, they were mice, not rats. They injected mice with RTX, which is a derivative of hot chili. They injected it to cause pain. And what resulted was a rapid depigmentation through damage to the stem cells. And that effect was blocked by giving pain relief immediately after they were injected with the RTX. So I'm going to show you some photographs of some of these mice, and you will see instantly what is going on. And when you think about what Sarah has been saying for years about coat pattern being an indicator of pain and a problem in the dog, then this is evidence, as far as I'm concerned, this is really dramatic evidence that she is right and that there's more research needed on this. Hopefully not done in a way like this. But the researchers, it's important to note, the researchers were not interested in the coat texture changes or the changes in the body. They were only interested in changing coat color, because what they were actually doing was looking at depigmentation of hair in people. So they were looking at creating drugs to stop that. So that's what they were trying to work out. They weren't interested in the coat texture changes. But when you actually look at them, the pictures, it's dramatic. So I'm going to show you some of these pictures. Okay, so this is the photograph that was this research was reported on the BBC website as well, and this photograph was one of the photographs that they put up, and that was the mouse. The one above, the black mouse, is the mouse before pain was induced, and the bottom is sometime afterwards, after pain has been induced. Look at the difference, the coat color change, but also the coat texture change. And look at the difference in the body of the mouse. Look at the tail, the kink in the tail and things like that. It's dramatic. The change is dramatic in these animals. And this is the impact of pain. And this for me was, I just couldn't believe this. This is some of the photos, the pictures from the actual paper. And again, this is not a paper I would recommend reading. It's not a nice paper and it's incredibly difficult to read. But essentially, they found white hair formation. They were looking to see, did white hair formation happen with restrained CUS, which was the more serious stressor of unpredictable situation, and the pain, which is the nociception. And this is what they got with the control. These ones here is the control, and that is the very little change, which was saline. They were just injected with saline. And this is what you got with the pain injection. But really importantly, don't worry about all of the graphs unless you really want to get into it. But look at the difference here. This was RTX with saline. So this was pain, the pain injection plus saline, which did nothing. And this was the pain injection plus pain relief. It actually stopped the change in the coat. So the pain relief made a massive difference to how the animal was. And this was happening over, I think that previous one, if I just go back, I think that was one hair cycle. Yeah, this was one hair cycle. So one hair cycle was they basically took the hair down. So they cut the hair and then waited for it to grow. And it was the next growth cycle of the hair. So in one cycle, this was what you got with pain. When you look at the mild and severe stress, so chronic unpredictable stress was what you would call severe stress. You can see the change in the coat for sure. You can see that there's a different texture. You can see some color change, but nowhere near as dramatic as pain. And this is at over 3 to 5 cycles of hair growth. And then with restraint, again, you can see the changes, and you recognize some of these patterns you sometimes see in dogs as well, where you've got pain in certain areas of the body. And I would hazard a guess that the injection site for these rats was around here in the rump, because you can see the change of color there is greater, and similarly there. But you've got these changes in coat pattern happening with stress, but nowhere near as significant as with pain. So just to summarize what we're talking about with pain and stress, we look at dogs' posture, gait, symmetry, weight balancing, and coat, and all of those things can indicate pain. Coat change, I think, is the most under-researched indicator of pain there is. I think that we need to know more about it. We need to gather the evidence, even if we do it informally. And we need to really look at that to see what coat patterns. Let's take photographs. What is the coat pattern associated with something that is diagnosed that will have pain, so that we can gather that data, because nobody else is going to look at it. And we also obviously want to recognize those nervous system responses, the physiological and communicative signs, and we want to be responsive to all of those things. So ACE observations is really underpinned, and I would say particularly with things like that the Harvard experiment, way ahead of its time in knowing, in recognizing some of these signs, particularly of pain. And I think that it's really important to remember this, that I'm not saying for a moment that stress is not important. Don't read this wrong. I'm not saying stress is not important, but we tend to focus a lot on, is the dog stressed? We tend to focus a lot on that in our industry. We don't want to stress the dog. What about pain? Look at the difference. Look at how more extreme the body's response is to pain than it is to stress. And we are not paying anything like enough attention to pain in comparison to stress, in my opinion, because of this. I want to go back to school so I can study this. Me too. Me too. Life is just not long enough to do all the things you want to do. Okay, so that was a nasty experiment. And the rest will not be, so you can relax. You can come back from your cup of tea if you didn't want to see any of that. But it is, as people have said in the comments, incredible, astounding. It really is. And even though the experiment is horrible, and one of the problems with a lot of experimental work that is done with animals, it is horrible. It's getting better, but it still, there's a lot of horrible things that are done in the name of science to animals. And one of the things that we get to do is look at, well, how can we get the information without being so horrible to animals? Anyway, next thing, importance of balance. And I just wanted to give a shout out here to Lisa Webb. Lisa Webb did a fabulous, and it is available on the ACE Resource Hub, called The Science Behind ACE Free Work. It's unpublished, but it is brilliant. And a lot of this section comes from her thing. In fact, the first picture that I've got is her picture. So yeah, just a big shout out to Lisa. Definitely read that paper. But the balance system. So just to give you the overview, just as we had the overview of the stress, the fight or flight system, the overview of the balance system. We've got proprioception, which is the receptors that we've got in our muscles and in our joints, which tells us where we are in the world. We've got vision, we've got what we're seeing, and we've got our vestibular system, which, and Sarah talks about all of these, when she talks about the senses, all the extra senses, the proprioceptive senses, the vestibular senses. It's about balance, it's about motion, it's about working out where we are in relation to things. It's the thing that gets us confused when we think we're moving and it's actually something else next to us that's moving, or when we don't realize we're moving and then something next to us starts to move and we realize it's us that's moving. That's all vestibular. And all that information comes into the brain and it's processed in these two different areas. And we learn information about what we've previously experienced about balance, about how to balance, both in terms of what we've learned. We need to move differently. So those of us who have slipped on ice will probably know that we have to move slightly differently when we're on ice. And then also just automatic movements that our body has learnt to do to be able to do things, the practice our body has had, the muscle memory, if you like. And that sends signals back to the body, to the muscles, to the eyes, and that leads to motor output. So that's your balance system, and it's a constant sort of cycle round. And there's a few papers that are really interesting relating to the relationship between balance, emotion, and behavior. And one of the things that we're doing in ACE is we're observing how balanced the dog is, and then we're helping them through free work. And this is the kind of the link towards the move towards free work. We're helping them to become more balanced. So the first thing is that postural control takes up attention capacity. And that depends on the task that they're doing. It depends on the age and balance capability. And if it's an effort to balance yourself, to organize yourself, then performance in other tasks will deteriorate. So that's the first thing. And that's really important. So postural control takes attention capacity. So if you've got a dog who is struggling to balance, maybe they're slipping about on a slippy surface, or maybe their body is not very balanced and their front end doesn't know where their back end is going. We've all met dogs like that. Then that is taking up brain processing. They are not going to be able to do other tasks. They're not being able to concentrate so much. It's going to mean that they're not going to learn so easily. So sometimes we might think that these dogs are being awkward or difficult or stubborn. How many of us heard that? You know, the dog's just being stubborn. Maybe it's just that their brain is focusing so much on how to stay upright that they're not able to think. And there's evidence that there's research behind that. Second research is that there's a correlation between poor body balance and impairment in cognitive skills, particularly memory, concentration, and attention. So again, backing up the same thing, that the Bigelow and Agrawal have shown a correlation between not being balanced in the body and particularly loss of memory or lack of memory, inability to remember things, an inability to concentrate, inability to pay attention. And again, How much do we see that, particularly in dogs? And this can be in with adolescent dogs. So somebody mentioned adolescent dogs before. Adolescent dogs are notoriously unbalanced because their growth is all over the place and they haven't quite worked it out yet. And so for a lot of dogs, particularly larger breeds, when the adolescent is often not very well balanced. And so if we're looking at balance, we want to be thinking about, well, what's the impact of that going to be on the dog's ability to concentrate, to think, to pay attention? And are we asking too much of them to insist on, we kind of think that, and often it's a traditional thing, isn't it? They've gone through puppy, they should have learned all that stuff. They should be able to pay attention by now because they've been doing all this training. So why have they suddenly gone off the rails? Maybe because their brain is now focused on, they're affected by their balance, the body balance. Third thing, vestibular disease, which affects balance. The vestibular system, remember, is working around balance. It's affects the ears as well. Often presents with anxiety. And it's been suggested that there should be an integrated model of gait and posture, vestibular pathways, and anxiety. So looking at the relationship between those things, that those things are all interrelated. And so you need to look at gait and posture and anxiety together. So if we're seeing a dog who's anxious, are we seeing a dog who's not balanced? Are we seeing a problem with gait and posture? And if we can improve gait and posture, will that improve balance? And what was interesting is that they have shown it the other way, that if you can reduce anxiety, then you will increase their balance. So there was a study by Lepicard et al., where they showed that mice who had high anxiety, so another horrible thing about the science world is that they breed mice and rats to have specific traits. And these mice had been bred to be high anxiety. So they've been bred to have that as a trait. So they bred high anxiety mice, and they found that they had more difficulty traversing a moving beam, which is a pretty normal thing for rats and mice to do, to be fair, than the non-anxious mice, the normal mice, if you like. But that when they treated the anxious mice with anti-anxiety medication, they improved their performance on that beam to the same level as the non-anxious mice. And when they gave anxiety-creating medication to non-anxious mice, they reduced their level of balance to the same level as the original anxious mice, if that all makes sense. But you get what I'm saying. So basically, they did experiments where they made highly anxious mice less anxious and balance improved. They made non-anxious mice anxious and balance deteriorated. There is a correlation between those two things. So if you can improve balance, you can improve anxiety. You can reduce anxiety. And it's really, really useful for us, those of us who work with anxious dogs, who work with dogs who have fear-related behaviors, that this is a really important finding for us. Okay, is everybody with me so far? I've taken sanctuary dogs, noticed a huge difference when we spent time doing free work the day before his third session. We walked in the park before his hydro, his nose didn't leave the floor and he slowed himself right down. Yeah, perfect. So looking at things where you've got dogs who have got an imbalance because of amputation, you start doing things like free work where you are improving balance, you're going to improve their emotional state as well, which is really important. Okay, so poor balance takes up cognitive capacity and it will affect decision making and learning. Poor balance is also linked to anxiety, may be linked to anxiety. Reducing anxiety is likely to improve balance, but also improving balance, like we do in free work, is that likely to reduce anxiety? And I would argue it is. I mean, they did show that when you added anxiety, you would reduce things. So it's a correlation both ways. It seems likely that is the case. So another reason why doing free work is so helpful. So that takes us neatly into free work. We've got about half an hour, 35 minutes left. I don't know whether we'll get through it. We'll see. We will see. But I'm trying to kind of cover a nice broad range of different things. And hopefully it will whet your appetite to go and do some more research of your own to find out either original research, which I would love to see, or do your own research around what is going on behind these things. So why ACE free work? So what is going on when we're doing ACE free work? Well, I would argue that there are at least 3 things going on that we can find reasons why these are beneficial to dogs, and why specifically what we do in ACE free work is beneficial to dogs. There's physical well-being. So there's looking at the facial and the neurofacial network and movement, and what the benefits of those are. There's emotional well-being, so looking at the emotional systems are activated. We're not going to talk about the physiology of emotion. That's I had to cut that out because of time, but that's really about what chemicals are reduced, are released, serotonin, oxytocin, all those sorts of things. That's again basic biology, and you can look that up. But the things that we do in free work will lead to the release of serotonin, oxytocin, dopamine, so those sorts of things. Perception of control, really important. We're going to talk about that. And then naturally reinforcing behaviors. So what is it about the behaviors that we're giving dogs access to within free work that actually are naturally reinforcing for them? So we're going to go through this really quickly, and this is a picture you don't need to worry about the details of, but it's just about the fascia or fascia, depending on how you pronounce it. But this is basically the layer of tissue that is all around every organ and every part of the dog. So it's under the skin. It's largely collagen, and it's apparently a fractal organ. I didn't know this, but I discovered this when I was researching this, and that's found really interesting. It's an infinite pattern that really repeats over and over. And you've got it everywhere. So you've got it at the cellular level, microscopic level, at the cellular level, and you've got large around all the organs. So it's the tissue that connects everything together. And pressure or tension in that network, so when you put any pressure or tension, so not necessarily hard pressure, but any sort of touch, sends an electrical charge with information through the body. It's dense with sensory nerves, and they include different types of sensory nerves that were there for sensing pain, the nociceptive, nociceptive, proprioceptive, which is sensing your body position. We've talked about both of those already. And then interoceptive, which is sensing the body's internal state, and that's self-awareness, problem solving, and emotional, how you feel emotionally. So that's what it's meant to do. And when your fascia is disorganized, it can become restricted and tense. It can get sticky and scarred and thickened, and layers stick together, and it doesn't move the way it should. And chronic stress can do that. Emotional trauma can do that. And that can also happen when the body is exposed to stress hormones. So just being aware of what is going on there, and you can help those things with body work, with stretching and passive movements. So the sort of things you might do in yoga, or gentle stretching exercises, low impact exercise, which is what we're doing in free work, and hydration. So with hydration, so drinking lots of water. So it's likely that what we're doing in free work, and also in the body work that we do in ACE, is working at a facial level. It's working at the facial level. And similarly to things like Bowen, working at that level in terms of body work. So that's just sort of giving you some of the background as to what might be, which parts of the body, and why this is particularly helpful to see why working on one area can have an impact on other parts of the body that you haven't actually worked on, because it's all connected through the fascia. That's the important bit. There's other research which shows that movement is vital to the development of healthy neural cells. And this, another very unpleasant bit of research, really, but they basically stopped mice using their hind legs. I think they were mice, they might have been rats. But it's always rodents that end up with these horrible things done to them, which, as somebody who has had rats in her life, I find very disturbing. But basically, they stopped the hind legs being used. The animals could use their front legs, they could groom themselves, they could eat. They were actually, they weren't showing signs of stress. But what they found was after 28 days of this, of not being able to use their hind legs, so they weren't doing weight-bearing exercise of any sort, they found that they reduced the stem cells, the neural stem cells, by 70%. So they weren't developing the neural cells that were needed to be able to think appropriately and to be functional, you know. And they've also found that neurons and the cells that support neurons didn't mature fully either when exercise was limited. So the upshot of that is animals are meant to move. Animals are meant to move. Sometimes we have animals who are not able to move very much because of pain, because of other things. And so what can we do in terms of low impact exercise that is going to help with this and keep their brains healthy, which is what we're talking about when we're talking about neural cells, is healthy brains. What can we do? And one of the things we can do is free weights. That's another thing reason why it's really important, because some dogs can't race around. They just can't do it for other reasons, the pain, the damage, other damage that they've got. So low impact movement. So for physical well-being, low impact movement supports that neurofacial health, potentially neural cell health, and it's particularly useful for dogs who can't exercise or do alternative exercise for physical or behavioral reasons. And touch, such as the gentle body work that we use in ACE, also supports that neurofacial health. So that's another reason why it's really helpful. So what about emotional well-being? Emotional well-being. And there's lots we can say about this. As I said, there's all the physiological stuff about the hormones that are produced in the body at different times and what causes those to be produced. And there's lots of really fascinating stuff about that, which I've had to take out because otherwise we'd be here still at 10 o'clock probably. But I do actually do a workshop on this. So I do a full day workshop on this where we can look at it in much more detail and really discuss the ins and outs of it. And, you know, feel free to ask about that. I haven't got one scheduled, but I'm happy to schedule one if there's enough interest. But I just wanted to talk a little bit about Panksepp and Panksepp's models of the emotional systems in mammals. So 4 key, what he calls the blue ribbon grade A emotional systems: rage, panic, fear, and seeking. And rage is I've got separate things. Yeah, before I move on to what each one is, the evolutionary purpose of these emotional systems is survival. So can you access this talk later to review? Yes, you can. I will put that, well, the recording will obviously be up in the Acing August group, and I will share a PDF of the slides. So yes is the answer to that. So the purpose of it is survival. The purpose of the emotions, the emotional systems that are going on is the animal's survival. And what you'll notice is that a lot of them are about protecting us from danger. And there's one of them which is about finding good things. But we will look at each one in detail. So fear is triggered by pain, and it's triggered by the threat of destruction or injury. This is the technical definitions in Panksepp's model of fear. Triggered by pain, it's triggered by the threat of destruction or injury. So think frightened animal in a trap and what the response is. The response to that is fight, freeze, or fawn, which is appeasement. fool around, distracting. And it's linked to emotions such as alarm, foreboding, terror, anxiety. All of those are words that we might use to describe the emotions you're feeling. And it can shift from fear to rage in certain situations, particularly when the animal cannot escape. And that moves the animal from flight, freeze, fawn, fool around into fight. And fear is reduced by managing exposure to the things that are frightening, the triggers. We all know this when we talk about counter-conditioning and counter-conditioning. So giving a more positive association with those things. Now, this I'll go through all four of them, and then we can look at how that relates to what we're doing in free work. So that's fear within this model. Rage in this model is frustration. It's the response to restraint and being immobilized or cornered. So rage is fear when you can't get away. Rage is the animal that is held down and lashes out. It's energizing. Rather than the freeze that you get with fear, it's energizing. It leads to fight. It leads to aggression. It's the thing that makes the animal fight back. And it's linked to emotions that we would call things like anger, indignation, hate, frustration. And again, it's reduced by managing those triggers, managing restraint, and counter-conditioning. So that's rage. Panic is the third of these four major blue ribboned A systems. There are three others as well, which I'll just mention briefly in a moment. But panic is related to social loss. It's related to separation. It's related to exclusion. It is what you hear every year when lambs get separated from their mothers. Yeah. It's where you've got but you get the panic from both the mother and the lamb. You get the mother panicking, where is my baby? And the lamb, where is mummy? That is panic. Okay, that is what panic is about. And it leads to vocalization. It's also, we'll see it in dogs, in separation distress. And emotions include panic, grief. Grief is the permanent loss of something, and loneliness. And it is reduced by body contact and food, because you get a release of endorphins, which help you to feel better, and amongst other things. There's a whole range of things, but those are the things that are relevant to us in terms of ACE. And then we have the seeking system. Now, when I say this is the key positive system, I don't mean that the others aren't positive, because let's remember, we always think about fear and rage and all those things as bad things, but they're not. They're protective things. Those are our nervous system looking after us. They're the dog's nervous system looking after them. So none of these things are negative, but those other three are protective, whereas this one is actually go out there and find good things. And that is what I mean by positive in this context. It's the seeking system is a system that causes the mammal to go and seek what they need. And that includes food, shelter, sex, warmth, social contact. Primary emotional system that actively promotes reward and well-being. The others protect us from harm, as I said. And the emotions that we're associating with seeking are anticipation, hope, satisfaction. It leads to a dopamine release, which is your reward chemicals, and suppression of the seeking system leads to depression. So those are your four major systems. There are three others, care, lust, and play, and they tend to be associated with specific life points. So care is maternal or paternal, can also be familial and social attachment. Lust is sexual attraction and behaviors, and play associated with joy. All animals will play, but it's particularly important for younger animals. But the seeking system is closely related to all of those things. So we're not going to worry so much about those three, but just for completeness, because those of you who know Panksepp will say, but there are 7 and you've only talked about 4. Well, that's why I'm only talking about 4. So how are these related to ACE? What is ACE doing when we do free work? What is happening, or ACE in general, what is happening with each of these? Well, in terms of fear, we are controlling triggers. So any of you, and if you're interested in this, I know I'm talking about it when I do my other talk at the end of the month about reactivity. I'll talk about how we control triggers within ACE. And I'm sure other people will be doing similar sorts of things. But we control triggers within ACE so that an animal can have exposure to something in a way that is safe, in a context that is safe, and in a context that is providing its own reward. So you're getting counter conditioning coming along for the ride. It's happening naturally because it's making the presence of that's the safe presence of that scary thing associated with something that's enjoyable, investigating, searching, sniffing, licking, whatever that is. So that's how fear and ACE fit together. If we look at rage, ACE, we remove restraint and pressure. So most other methods that I'm aware of for working with dogs who are struggling involve some form of restraint. That might just be having a lead on them. But that is a restraint which is going to put pressure on. Any of you who have worked with reactivity will know that often it is the lead that triggers, is part of the big trigger for the reactive behavior. So when we remove all the restraint and pressure, we're allowing the animal to explore in a way that does not necessarily, or is less likely to trigger the rage response. And as I said, just the same as with fear, counter conditioning comes along for the ride. What about panic? Panic, in ACE, you've got positive touch. So you've got, it's not the first thing that we do, but there is body work that we do within ACE. And we get licking and chewing. So we're providing opportunities to lick and chew, both of which produce endorphins for the dog. So that is helping with dogs who are in that panic state and helping them to be calm. So again, can be helpful. And then the last one, ACE activates seeking. I mean, I find it really hard to imagine an activity that is more in keeping with the seeking system than ACE-free work. You're basically providing an environment of wonder and loveliness for an animal to explore. And that might be different foods, it might be different scents, because you can also put scents down there. It might be just exploring a natural environment. All of those things, you're encouraging this forward movement, you're encouraging sniffing, you're encouraging investigation, all of those things that are central to the seeking system. So ACE is activating all of that. So when you're working in ACE, you're activating that positive system that is associated with release of dopamine, the reward-based chemicals, and so on. And so you're getting that beneficial result. Seeking, scent work. Yeah, I mean, seeking is not scent work. It's more than that, but scent work will certainly, sniffing is part of seeking, the seeking system. So that's your emotional, the emotional systems that I think how they relate to ACE. But what about control and choice? There's a wonderful book, which if I was on the other side of this desk, I would be able to pull off the shelf and show you, but it's about mental well-being in animals. And there's a paper in it, it's called Mental Health and Wellbeing in Animals, in fact. And there's a paper in it called The Mental Health and Wellbeing Benefits of Personal Control in Animals by Frank McMillan, who's also the editor of the book. And he did a survey. So this is a survey paper, it's a review paper. It's basically looking at lots of other different bits of research, much like this is a review presentation. And he's pulling out conclusions from lots of different papers. And what he's found in this paper is that animals will choose to exercise control whenever they can. So control is really important to animals. Animals with perceived control have reduced stress responses, better resilience to stress, they're more able to relax, and they have better cognitive function than animals without a perceived control. Perceived control is that they feel in control. It isn't actually whether they are in control, but they feel in control. So let's just take a case of a dog. A dog that we have living in our home, you might say, well, actually, they don't have a great deal of control about their life, because everything that we do, even when we're giving them control over things, we're controlling, aren't we? We're providing that for them. And so it's a bit of an issue for us if we want to give our dogs freedom to make choices and to exercise control in their lives, because actually, much like with children, really, we're exercising an awful lot of control on what they can and can't do. But if we can do things that give them that they feel control in that moment, in that activity, then it will have these positive impacts. It will have these positive effects. The other side of control is that if you feel you have no control, you have learned helplessness. And we've all seen that. We've all seen the dogs who just give up. We've all seen that. And that is because they feel they have no control. What is the point? What is the point of trying something if nothing you do influences what happens to you? There is no point. So you stop trying it. What's really interesting about this review was that they found that enhancing perceived control in some areas fosters an overall perception of control. So if we can give our animals some control over some things, then they will feel more in control over everything. And so taking something like free work, where we're giving them complete control over that situation, because we're saying, we haven't got a lead on you, we're not telling you what to do, there it is, go do what you want with it. That's control. They have control then. They can explore, they can stop, they can lie down, they can stop and chew something, they can lick something, they can do it whenever they like. It's nothing to do with what we're not telling them what to do. They have perceived control in that specific context that will increase their feeling of being in control overall. And that is really important. And a quote from this paper: studies show that animals desire control for the sake of control. That is, that control is rewarding in itself. So control is a reinforcer, self-reinforcing. And that control is desired for appetitive as well as aversive stimuli. Appetitive are things that you need, bodily needs, so things that are positive that you want, as well as avoiding aversive things. So it's not just that people want to control to make sure they don't get hurt, it's that they want control over everything, good things and bad things, and that control is rewarding in itself. So if we can give them control in some areas, like in free work, then we will improve their overall sense of control, and that is really important. So activate seeking system, gives choice, perception of control. Like it. Okay, so natural reinforcing behaviors, just very briefly, because we're 10 minutes. I did say I would stick to 90 minutes. I may not, but we will see. Okay, so this was a paper, really nice paper, Let Me Sniff, Nose Work Induces Positive Judgment Bias in Pet Dogs, by Duranton and Horowitz. And basically, they got two groups of dogs given cognitive bias tests before and after completing different activities. One group did nose work, the other group did heel work. And the cognitive bias test is a standard test that they use to determine optimism or pessimism. So just to show you what that looks like, basically they do a whole load of training trials where they have a bowl set out in one position or the other position, and it either has food in it or it doesn't. And they check to see when the dog stops going to the bowl that never has food in it. So they're always in the same position, not for every dog, but for that individual dog, they're in the same position. So the dog will learn that after a certain number of trials, that the bowl that's on the left side never has food in it. So what's the point of going and looking at that? And when they've done the training and they find they've got this criteria for moving on to the test situation, where they have an empty bowl in the middle, and they're testing to see whether a dog, having done all that training, whether the dog is optimistic. There's a bowl over there, it's in a different position. I don't know whether that has got food or not, because it's not one of the already associated positions. So I'm going to go and check it out. And an optimistic dog will do that quickly. A pessimistic dog will do that slowly. That's the essence of this. So what they found was Pre-activity, there was no difference between these two groups. So before they did any of the nose work or the heel work, no difference between the two groups. They would both have the same latency speed of going to check out the test bowl. Post the activity, the delay in approaching the ambiguous stimulus of the nose work group declined significantly. That is, they went quicker to check that out. They were more optimistic. So the dogs who had done nose work for 2 weeks, this is what they did. They basically did this test, went off for 2 weeks. One did a set amount of nose work. The other did a set amount of heel work. The nose work group basically were optimistic about what was in that middle bowl, and they went and checked it out quickly. The heel work group didn't change. It didn't make a difference. So what they concluded from this was that nose work increases optimism, the opportunity to engage in natural foraging behaviors, and the opportunity to exercise control over the environment, both important to that. But that it's about the increase in optimism. So doing things that are using the nose increases optimism in dogs. That's a good thing to know, because then you can use the nose. And what do we do in free work? A lot of nose work. There's a lot of using the nose. And then there's a paper here about, which was another review paper, assessment of positive emotions in dogs, in animals to improve their welfare. So this was a review that looked at, well, what did exploration and things do for animals, and what did they find out in terms of the emotions associated with this? And the key points that they found: exploration is a behavioral need for most animals. So animals need to be able to explore. It's self-reinforcing. And so animals just keep on doing it unless it's interrupted by some more immediate need. So they need to go to the toilet or something like that. So if a dog is exploring an environment, they'll just keep exploring it until either they're tired or something else interrupts that behavior. And inquisitive exploration may indicate that no other needs are present. And that is really important for us, because if a dog is exploring, then according to this review, that may indicate that there aren't other needs present. So particularly was mentioned the fear-based need for safety. A dog who doesn't feel safe, a dog who feels that they are under threat, will not explore, will not do that kind of just general exploration. So if you've got free work and the dog is not exploring, look at what's frightening them. Look at what their other needs are taking over that mean that they can't explore. And that is something which, again, within free work, because it's free, we can see that. We can see that happening, because we can see the dog not actually engaging. Well, what is it that's stopping that? Is it fear? Is it that they have other needs? Is it pain? And we can start to look at those things. We're nearly done, people, so don't get too, at least I think we are. I don't know where we're up to in numbers. Anyway, problem solving. So this was an experiment that they did with, it's a pilot study, it's a small study, but problem solving games as a tool to increase well-being in boarding kennel dogs. So they basically took dogs who were boarded by their owners in a kennel, and some of those dogs were given problem solving activities to do while they were in the kennels, and other dogs weren't. So it wasn't that they were starved of anything, they just weren't given these problem solving activities. And then they got the owners to go and do some tests to check or to observe qualitative, subjective tests that they would mark off. This is what I'm seeing in my dog. And they found that the dogs who had done the problem solving activities while in the kennels displayed decreased stress behaviors and an overall decrease in high level stress when they got home. And the control group, who had just done normal kennel things, showed an increase in high stress level when they got home. So again, really, really helpful looking at that problem solving. And of course, within free work, we use problem solving activity games and things like that within the context of the free work. So dogs can choose to do those things. And then one final thing on this, on stress and the impact of play behaviors and things on enrichment the impact of enrichment on play behaviors. This was, again, nasty things about the way that they handle animals in experimental conditions. Prenatal stress. So some of these rats had been subjected to prenatal stress before they were born, subjected to stress. And some weren't, some were normal. Okay. And what they found in this study was that social play behavior increased. Social play. I'm getting tired. You can tell I'm getting tired. Social play behavior increased, and corticosterone, which is stress hormones, decreased following environmental enrichment in the prenatally stressed rats. So when you had rats who had been prenatally stressed, you could give them an enriched environment, and it would increase their social play and decrease their stress hormones. They had a control group of non-stressed rats who were also given environmental enrichment, and they increased their social play behavior, but it didn't change their stress hormones. And what they also looked at was, could they actually use enrichment to reverse the hormonal effects? And the answer to that was yes. So the hormonal effects of being stressed prenatally were reversed, in fact, by environmental enrichment. And again, what you've got in ACE free work is environmental enrichment in a structured form. So all really interesting studies. Now, obviously, these aren't about ACE, but they give us some background that help us to sort of see why these things might be working. So it incorporates nosework, so it increases optimism, facilitates inquisitive exploration, which we know is self-reinforcing, and we know that it provides ongoing pleasure. It includes problem solving, which we know reduces stress, or from this study, we know reduce stress in that study. And it increases enrichment, which helps with recovery from stress. So those are all reasons why ACE can really help dogs. ACE-free work can help dogs who are struggling with stress and help them to recover stress. Not surprised you're getting tired. Yeah, just getting big. So I'm done pretty much. This is just the tip of the iceberg. As I say, this is a reduction of a 6-hour workshop that I do. There is loads more as well. I'm sure there's stacks more research, and I'm sure that many of you who read the literature and look at things will be able to throw in lots more to the discussion. And I would love to hear from you if you have that information. Just share it, because one of the things that we can do here is really just see, well, how can we show and demonstrate that this is something which is really worth doing, and it's not something that's a bit weird out there. It's not at all. It's completely grounded in what we know benefits animals. So that's it. If anybody's got any questions, I am happy to try and answer them. We've got about 3 minutes until the 90 minutes is up. If you want to find me, if you want to connect with me at any point, then please do find me at Heart Dog Trainers on Facebook. It's a new group just set up with Michelle Dart. And it's a new business that we're setting up, and we're really focused on well-being. ACE is a big part of that. It's been a big part of what I do for the last 4 years. And so do join us there at Heart Dog Trainers on Facebook. And we've got a temporary website at heartdogtrainers.com, which you're welcome to come and sign up there for our email. There will be emails coming up, probably not in the next couple of weeks because we're just getting everything sorted, but we would love to stay connected with you. So thank you. Any questions? Thank you for all of the lovely comments. That's really lovely. Okay, lovely. Okay, I think everybody's head hurts too. My head hurts too. So maybe this isn't the time to ask for questions. If you want to ask questions, if you want to, you may want to go through it again. Then do drop back into the questions. If you're watching on replay, just put #replay so that I can note your comment, and then, or if you've got a question, put Q, and then I'll know it's a question. And I will loop back and try and answer questions as they come up. Lots of evidence to throw at your vet. Excellent, Jenna. Excellent. We like that. We want to provide evidence, not necessarily to throw at vets, but certainly to help us to make the point with vets. Okay, I will put how do breed traits affect this? Oh, that's a really interesting question. And to be quite honest, I'd have to think about it. I don't know what I mean, from a research point of view, I don't know what research has been done on different breeds. I would guess that breeds would make a big difference to some of those things and not to others, certainly to the physical things. Breed obviously will make a difference. But yeah, I mean, a Saluki has particular physical sort of makeup. Balance will be really important for a Saluki. Scent will be really important for a Saluki as well. So yeah. Okay. So yes, to have to think about that. Can I put a PDF up with the slides? That would be fantastic. Yes, I can. What is the time frame for a dog who starts ACE free work to see positive improvements? This is really interesting one. It's not, I don't know the answer. I think the answer is probably it depends. I think that's probably the answer to most things in ACE. It depends. But looking at the looking at sort of some of the things, I think she may not be here. I don't know if she's here. Fiona, are you here? Fiona Brunton with Ben, and just looking at what how quickly something can change. So Fiona very kindly shared with me photographs of her dog, and it wasn't through doing ACE, although he was doing ACE, which helped with balance and so on. And ACE has certainly helped him with. She's posted in the group today actually that ACE has helped him with being calm around things that would have previously really triggered him. But there was also to do with pain relief and having pain relief on an injury and the difference that it made in the coat pattern. And she showed me pictures, which was just over a few weeks, a complete change in coat pattern over a few weeks, which is backed up as well by the photographs of the mice in that paper. So I would say that, you know, if you can address pain and you can address the stresses, the physical stresses, that is actually going to make a big difference quite quickly. But I'm not about to give you a time scale on that. Okay, I think we're probably out of time, but it's been great fun. Thank you for having me. Thank you, Penny. I'm going to bring Penny in. I'm going to take my slides off. Oh, I can't do it on there. Hang on. I need my other. Whoa. I need to find. Oh, there we go. I seem to have got rid of something. Was that you, Penny, that did that? No, I've lost my other mouse. What did I do with it? Put it over there so I wouldn't touch it. Now I can't find it. Okay, let me bring Penny on. There we go. There's Penny.
Oh, hiding in the background.
Hey, so thank you.
Thank you. Absolutely brilliant.
Oh, well, thank you for having me. And thank you, everybody, all 4 of you who are running this. It's absolutely brilliant. I mean, what you're doing is absolutely brilliant. And I just love the fact that you're getting ACE out there to so many new people, which is what we want, because it is such a powerful
thing. My mind.
Such a powerful thing. All right, guys, thank you so much. I will love you and leave you. I'm going to go and get some food and rest. Okay. And I will post that PDF, but it might be tomorrow because I'm going to take a little bit of a break now. All right. Okay, everybody, take care. See you.
Bye.
Bye.